It's your station. Have you done reading?
Yes, ma'am.
All right. So if you've read and understood, considering this surgical anatomy station, please tell me what exactly are you looking at?
This is a shoulder injury. At this image, I'm looking at the brachial plexus.
Okay. How brachial plexus are formed?
They're formed with the union of ventral rami from C5 to T1.
All right. Okay. Uh, can you tell me the surface anatomy of brachial plexus?
Yes, it starts with the roots. The roots originate from between the intervertebral foramen, and they are between the scalenus anterior and medius. And then there are trunks. Trunks are at the base of the or at the base of the posterior triangle of the neck, and behind the
Yes.
third part of the subclavian artery.
Yes. Then divisions and cords.
Then
Kindly
yes,
tell me quickly. Yes.
divisions are behind the one third of the lateral third of the clavicle,
Middle, one third of
middle
the
third of the
clavicle.
clavicle,
And then
and
cords.
cords are second part of the axillary artery.
Yes, right. And that's how the names of the cords are given or called. Please, all right, tell me what are the branches of the brachial plexus? Very quickly, you have to tell me.
Yes, ma'am. Lateral cord has three branches: lateral pectoral,
Oh,
muscular.
wait, I'm sorry. I said branches of brachial plexus, not the cords.
Okay. Uh, Branches of the brachial plexus.
Begin with roots. Yes, roots have.
The upper trunk has okay. Begin with root. Root has two branches. That is, one is dorsal scapular and long thoracic, and
Long
then
thoracic and nerve to rhomboids, and there is
and
nerve to subclavius.
yes, okay, and there is a branch to the phrenic as well. Okay, yes, and then there are two branches of the upper trunk. That is suprascapular and suprascapular and subclavius.
Okay. These branches are from the trunk,
Yes,
suprascapular,
yes.
and supra and infraspinatus. All right. And division has how many branches?
Division. There are anterior and posterior divisions of each trunk, upper, middle, and lower. Then those divisions make up a lateral cord, posterior cord, and medial cord.
Yes. And
Lateral
divisions
cord
have
has
no branches. Good.
yes,
And what are the branches of the cords? Very quickly, you have to tell me.
yes. Lateral cord has three branches: musculocutaneous, lateral root of median, and lateral pectoral nerve. Posterior cord has five branches: axillary, radial, subscapular, thoracodorsal, superior and inferior subscapular, thoracodorsal, axillary, and radial. And medial cord has five branches as well: medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median, and ulnar.
Can you please identify structure D and E, please? Very quickly.
Yes, E is musculocutaneous and sorry, D is musculocutaneous and E is axillary nerve.
Okay. And what about C?
C is ulnar nerve.
Yes. All right. Please tell me what are you looking at here
This
in
is
picture C?
this is a shoulder joint.
Yes. Please tell me how shoulder joint is formed.
Shoulder joint is formed with the two bones, three bones, scapula, clavicle, and humerus,
Head of the humerus.
and head of the humerus. And
What are
there
the
are
yes, what are the structures which stabilizes the shoulder joint?
rotator cuff muscles
Only,
stabilizing.
only.
There are many ligaments as well, and
Yes.
there is joint
There are tendons
glenoid.
and ligaments as well. Please tell me everything.
Yes, tendons and ligaments as well. There are three ligaments: coracoacromial, coracoclavicular, and coracohumeral. These are three ligaments. And then there is glenoid labrum, glenoid cavity, and then there are rotator cuff muscles which stabilize the shoulder joint.
Okay, what are the where exactly this shoulder joint is least stable? In which
At the
position?
inferior part of the shoulder joint, it is least.
Okay. Can you please identify? Now I want you to identify certain structures. If you can come here on picture A, please identify number 2.
It's acromion angle.
Acromion. Okay, please identify number 5 here, picture A.
This is infraspinatus fossa,
Right, and 15.
supraspinatus fossa.
Please come here on picture C, identify number 11, please.
It is subscapularis fossa.
All right. Okay, please tell me if you are looking at picture here.
Yes.
All right, which joint is this?
This is
If you could maybe,
glenohumeral,
okay,
glenohumeral joint.
right. Okay, please tell me, what are the structures which are attached to the coracoid process of humerus?
There are three muscles and three ligaments.
Very good.
The ligament that I already told: coracoacromial, coracoclavicular, and coracohumeral.
Yes,
And
muscles.
muscle is pectoralis minor, coracobrachialis, and
Biceps, shorthead.
biceps.
Right, please tell me, what are the muscles which form the rotator cuff?
Infraspinatus, supraspinatus, subscapularis, and teres minor.
Right, please tell me the origin and insertion of supraspinatus muscle.
It arises from the supraspinatus fossa, and it inserts at the
Greater tuberosity.
greater tuberosity.
Right, please tell me, right. What are the muscles which are inserted in the bicipital groove of the humerus?
It's there are three muscles lady between two majors, pectoralis major, latissimus dorsi, and teres major.
And this you are telling me from lateral to medial, right?
Yes.
Okay, please tell me what kind of image are you looking at right now?
This is coronal MR of shoulder joint.
Okay. Please give me indications. When would you ask for this kind of imaging?
When there is shoulder dislocation or any tendon tear.
Yes, any suspected shoulder injury. Please identify number 1.
Number 1 is acromion.
4, please.
It's clavicle.
5.
5 is deltoid.
Right, and 6 is pointing at what?
Glenoid cavity.
Yes, all right. Right, okay. Can you tell me the boundaries of quadrangular space?
Yes. Okay. Superior is teres minor. Inferior is teres major. Medial is long head of triceps, and lateral is humerus.
Neck of humerus, to be precise. Please, what passes through the quadrangular space?
Quadrangular space, there is an artery named called circumflex scapular artery.
It's not just arteries, it's the vessels. And the most
And
importantly,
sorry, yes,
axillary
there
nerve.
is posterior circumflex humeral and axillary nerve.
Axillary nerve and posterior circumflex humeral vessels, not just artery, vein as well, accompanied. All right, okay, good, thank you.
Thank you, ma'am.